Hi, my name is Rachna, and I will be going through methylxanthines. What is caffeine slash methylxanthines? Methylxanthines come in a wide variety of forms, and in its most popular form is known as caffeine. Caffeine is part of the methylxanthines family. It is found in lots of popular drinks as well as drugs. It was found by the German chemist Ferdinand Runge, and the chemist first initially called caffeine café base. The term caffeine appeared in 1823. Here we have the caffeine content of some of the most popular caffeinated drinks as well as candies. For coffee, Starbucks takes the lead at 310 milligrams for a grande cup of medium roast coffee. Tim Hortons is next with 205 milligrams, followed by McDonald's with 145 milligrams. We can also find caffeine in candies as well as ice creams and snacks. Ben & Jerry's has 70 milligrams per 1 cup of ice cream, and the Cliff Energy bar has 50 milligrams. Teas steeped at 3 minutes vary in caffeine content, but usually stay under 50 milligrams. Pops like Coca-Cola have from 20 milligrams to 50 milligrams of caffeine. Mountain Dew has 54 milligrams, and a Monster energy drink has over 180 milligrams of caffeine. Where can we find coffee? We can find coffee from the tree/bush of genus Coffea. The most common species is Arabica and takes 60% to 80% of coffee production. The other 20 to 40% come from the species Robusta. Coffee is picked at plantations in tropical climates like Africa, South America, and Hawaii. Caffeine is inside a berry that is picked from a dried coffee bean. Preparation of coffee can affect how much caffeine is in 1 cup. Another popular form of caffeine is teas. Tea comes from genus Camellia in the form of leaves, buds, and stems. Tea actually has higher caffeine content than coffee, but the potency is lost once tea is brewed. Teas that come semi-fermented like oolong and white teas oxidize. Oolong tea stops at oxidization levels of 5 to 40%, and white teas stop naturally by the sun at 8 to 15%. Green teas are unfermented. The level of methylxanthines in a cup of coffee depends on environmental factors as well as how long the tea is brewed, water temperature, and if the tea is bagged or loose leaf. Cocoa is found from the cocoa tree in the Amazon rainforest. Cocoa is a processed product found from this tree. One pod is about 6 to 10 inches long and 2 to 4 inches in diameter and comes with about 20 to 40 beans. To ferment, seeds are removed and left for 5 to 6 days till pulp ferments. This heats the beans, and the beans germinate and dry in the sun. Fermentation creates an unsweetened chocolate that is high in fats, and it was until 1828 that a press was made to remove most fat in cocoa butter, and the chocolate began to alkalize. Chocolate is made from roasting and alkalizing refined beans and sugar. Cocoa butter is added if companies are making milk chocolate. Methylxanthines found in chocolate are not just limited to caffeine. We can also find theobromine and small methyltheophylline. Other sources of caffeine come from herbal teas like yapone and guarana. Herbal teas that are made from ilex plant have caffeine equal to 5 cups of coffee. It is a popular drink in rural regions of South America, and after consuming this herbal tea, people will vomit this out to avoid caffeine overdose. Yapone is consumed by indigenous peoples of southeastern U.S. It was once restricted to great men and chiefs, but after World War I, it was enjoyed when coffee was not available. Guarana is made from Paulina capuna, is potent, and grows in the Amazon. Methylxanthines are popularly taken as a beverage or as a dietary supplement. Though oral administration is often the way to go for most people, children who need methylxanthines may have to take it as a rectal suppository or by intramuscular or intravenous routes. Transdermally, caffeine is used in anti-cellulite and anti-aging cosmetic creams. As for absorption, methylxanthines are not lipid-soluble and have a very low pKa. With consideration of the pH of the digestive system and any other pH encountered in the body, methylxanthines will not be ionized. Methylxanthines, however, can pass easily through tissue membranes. Because of this, oral ingestion of methylxanthines are quickly absorbed into the bloodstream from the digestive tract, and about 90% of coffee that is consumed is cleared from the stomach within 20 minutes of consummation. Coffee, tea, energy drinks, and chocolates are alkaloids when consumed. For medicinal purposes, methylxanthines are used to treat asthma. Caffeine is widely distributed throughout the body's tissues. It goes to all organs but will leave and enter at different rates. A study of death by caffeine overdose found that high concentrations of caffeine were found within the stomach, kidneys, liver, lungs, heart, brain, skeletal muscles, skin, urine, and blood of the deceased. Caffeine will also cross the blood-brain barrier as well as placental barriers without trying. This makes caffeine present in all body fluids, including breast milk. Theophylline and theobromine are less lipid-soluble than caffeine and are slower to pass throughout the blood-brain barrier. Elimination of caffeine is pretty simple. 1% of caffeine is excreted unchanged in urine, but the other 99% of caffeine molecules are metabolized almost only in the liver. The peak metabolite levels are 6 to 8 hours following caffeine ingestion, after which they are broken down by the liver and gradually exit the body. The half-life of a given dose of coffee is usually the same and ranges from 2.5 to more than 7.5 hours, averaging at 5 hours. Caffeine's half-life may actually be dose-dependent. At concentrations of 70 to 100 milligrams, caffeine clearance from the body proceeds at a constant rate of 1 milligram per minute. Larger doses of caffeine, like 250 to 500 milligrams, show slowed elimination rates and clearance becomes non-linear. In females, it has been shown that caffeine metabolism is impacted by hormone levels. The half-life of caffeine after ovulation was longer compared to before ovulation of a menstrual cycle. As well, oral contraceptives have been shown to extend the half-life of caffeine. Caffeine is an adenosine receptor that affects mainly the A1 and A2A receptors. A1 receptors are found throughout the brain. It is found in highest densities of the hippocampus, cerebellum, cerebral cortex, and certain thalamic nuclei. A1 receptors are found in medium densities in substantia nigra, neostriatum, ventral tegmental area, and the nucleus accumbens. A1 receptors are located postsynaptically and presynaptically and act as heteroreceptors to inhibit neurotransmitter release from the neuron, making acetylcholine, GABA, glutamate, norepinephrine, serotonin, and dopamine. A2A receptors are concentrated in dopamine-rich areas like the dorsal striatum and nucleus accumbens. There are subjective and rewarding effects from caffeine on these receptors. This is a result of both direct and indirect actions. Low levels of adenosine make people feel more alert, while high levels make them more tired. This is because adenosine rises over the course of the day, making us feel more tired. But when these receptors are blocked by methylxanthines, we feel less tired. Outside the central nervous system, caffeine still has large effects. Caffeine takes direct action on muscles, leading to smooth muscles becoming relaxed and increasing the strength of striated muscles. Smooth muscle relaxation leads to the dilation of the bronchi in the lungs, which decreases airway resistance. The bronchi is the main passage of air in the lungs. Nitric oxide moves into the tissue and is synthesized by demand. Nitric oxide diffuses into neighbor cells, makes a change, and is broken down within a few seconds. Methylxanthines can either dilate or constrict blood vessels. Endothelial cells produce nitric oxide, which can dilate vessels. Nitric oxide is a major inductor of vasodilation in peptide endothelium and is the most potent inducer of vasoconstriction. Nitric oxide and endothelium are signaling molecules that are produced in blood vessels in response to cues from the nervous and endocrine system. As each molecule binds to its own receptor, smooth muscle contraction will lead the blood vessel diameter to increase. The adenosine receptor will either produce vasodilation or vasoconstriction. Vasodilation is the increase in diameter that causes blood pressure in arteries to fall, and vasoconstriction is when blood vessels constrict and tighten. Vasoconstriction will narrow arteries and increase blood pressure upstream into the arteries. The brain's adenosine activity at its receptors will dilate blood vessels, and caffeine will reverse in action. At 250 milligrams of caffeine, vasoconstriction can release cerebral blood flow at about 30%. Methylxanthines also increase the need to urinate. We don't notice we need to urinate until we get closer to a full bladder, and this is because our sensations are decreased. This means that there is an increased flow rate in volume of urine. Methylxanthines stimulate the release of epinephrine from the adrenal glands, increasing the sympathetic nervous system, changes our vascular tone, heart rate, and body temperature. Our SNS is our fight or flight system and is the reason for the increase in urgency to use the bathroom. The bronchi in the lungs relax, and the medulla is also stimulated by high doses of caffeine and increases the rate of breathing. The adrenal medulla secretes norepinephrine and epinephrine in response to stress. Consuming 250 milligrams of caffeine can cause an increase of blood pressure. High doses of caffeine can lead to tachycardia and other physiological changes. 5 to 10 cups of coffee can cause sensory disturbances such as ringing in ears, seeing flashing lights, mild delirium, and excitement. The cerebral blood vessels dilation are associated with headaches. Caffeine can help with headache pain. People who miss their regular daily coffee may feel abstinence syndrome, a withdrawal that includes fatigue, flushing, nausea, anxiety, and a headache. Adenosine release causes neurotransmitters like serotonin, norepinephrine, acetylcholine, and dopamine to release, so that this could be the biological explanation for abstinence syndrome. Serotonin and dopamine affect sleep, mood, attention, and learning. Norepinephrine is an excitatory transmitter in the peripheral nervous system. Acetylcholine is a ligand-gated ion channel released by motor neurons that will bind at the neuron synapse of the skeletal muscle cells. Motor neurons bind to this receptor and open an APSP. An APSP is depolarization that brings the membrane potential toward the threshold. When acetylcholine is released by neurons, this activates the transduction pathway. G proteins in the pathway inhibit adenyl cyclase and open potassium channels in the muscle cell membrane, affecting the rate at which the heart pumps. The effect of acetylcholine is an IPSP in this situation. This opens the channel, postsynaptic membrane hypopolarizes, and moves the membrane potential further from the threshold. This study sought to find the effects of caffeine on alertness and mental performance. It measured motor tasks, mental performance, mental alertness with various tests. It found that caffeine has no serious benefit for mental alertness and mental performance of medium-high consumers. Non-low consumers actually had reported issues with anxiety, but had higher mental alertness. This study sought to find if there was a relationship between neonatal caffeine treatment and brain structure of 11-year-olds with the treatment of caffeine, and if there was a relationship between neonatal caffeine treatment and brain development until the age of 11. Caffeine had an impact on the corpus callosum for the group of kids that were 11 years old and were taking the caffeine as a treatment. There were no clear benefits of caffeine on brain structure and development at the age of 11. This last study wanted to see if the functional changes in A1 and A2A receptors were caused by genetic variations that changed the body's response to caffeine. The study predicted ADORA2A variation will affect the self-reported anxiety after 150 milligrams of caffeine, and DRD2 genetic variation would influence anxiety after caffeine consumption. Both these genetic variations had an effect on caffeine-induced anxiety. Coffee can lower the risk of type 2 diabetes, but this is if consumers drink 6 cups of coffee a day. Decaffeinated coffee also provides protection against type 2 diabetes. Caffeine can cause weight loss or prevent weight gain by increasing our metabolism. It is also credited for reducing the risk of mortality from coronary heart disease, heart failure, arrhythmia, and stroke. This would not be the case, however, for those who drink too much or too little coffee. There is evidence of protecting our brains from Parkinson's and Alzheimer's, and it diminishes the loss of dopamine producing neurons. There are a lot of cons, however, to drinking caffeine. At 400 milligrams of caffeine, this is okay for healthy adults, but higher and in combination with other stimulant ingredients is bad. Caffeine can cross the placental barrier at 200 milligrams in the mother, and this can result in reduced blood flow to the placenta by 25%. Maternal caffeine consumption is also related to the slowing down of fetal growth. There is a 19% increased risk of pregnancy loss for every 150 milligrams increase in caffeine intake. Methylxanthines are also found in breast milk. The rate of methylxanthine metabolism in newborns is extremely slow, and small amounts of caffeine can build and become toxic. There are also adverse consequences of drinking energy drinks and shots. Drinking in moderation will unlikely result in adverse effects, except for those with heart conditions or children. Some common reactions to energy drinks are alleviations in blood pressure and heart rate, and minor cognitive effects such as insomnia. Excessive consumption of energy drinks is medically hazardous. The adverse reactions to energy drinks between 2004 and 2012 were dizziness, tremor, hyperventilation, renal failure, vomiting, diarrhea, incontinence, fluctuations in blood pressure, fainting, anaphylactic shock, heart palpitations, chest pain, heart attack, hemorrhage, stroke, disorientation, spontaneous abortion, depression, anxiety, aggression, blindness, deafness, hallucinations, and convulsions. Though caffeine content is not as high as a large cup of coffee, the health consequences are greater. Energy drinks usually are highly carbonated and are usually consumed more quickly than coffee. Energy shots in most concentrated form are easier to consume rapidly. Marketers target adolescents and young adults for their amazing performance-enhancing and stimulating properties of the product. Energy drinks are also socially appealing. Caffeine is not a nutrient, so we wouldn't find caffeine content on the nutrition facts panel, but caffeine amounts are usually listed on energy drink products. The World Health Organization includes caffeine dependence syndrome in its classification system. APA set caffeine apart from other intoxicating and withdrawal-producing substances because caffeine is used by the large majority of the world's population. It is usually self-administered in daily doses that fall within safe limits and who generally suffer no harmful effects. Chronic caffeine consumption has health benefits not afforded by daily use of most other non-prescribed drugs. The possibility remains that some people may self-administer caffeine in a disordered manner, and much more investigation of caffeine abuse is required. There is a section in the DSM-5 for caffeine use disorder, and the requirements are a persistent desire or unsuccessful efforts to reduce or control caffeine use. 2. Continued caffeine use despite it causing exacerbating and existing physical or psychological problems, and withdrawal symptoms upon stopping or reducing caffeine intake. Caffeine dependence there was a study published in the Journal of American Medical Association of 99 individuals interviewed. 3 people were diagnosed with caffeine dependence and consumed daily doses that were lower than the average daily consumption in the U.S. Caffeine intoxication, if ingested more than 250 milligrams a day, can cause restlessness, nervousness, excitement, insomnia, flushed face, diverse gastrointestinal disturbances, muscle twitching, rambling, flow of thought and speech, periods of inexhaustibility, and psychomotor stimulation. Tolerance to drinking lots of coffee can cause upregulation in both the number and the sensitivity of adenosine receptors. Behavioral effects in rats include after 8 injections, doses could only depress, responding to 75% of the baseline. In humans, caffeine has less effect on heavy drinkers than on non-drinkers. 150 to 300 milligrams of caffeine produce complaints of jitteriness, nervousness, and upset stomachs in non-users, but users also reported feeling alert, less irritable, and more content. Individuals who were more resistant to effects of caffeine might also be the ones who are heavy coffee drinkers. Sleep-disrupting effects of caffeine show tolerance within 7 days, and subjective effects are tolerated within 4 days. Tolerance can build at different rates. Caffeine effects seem to disappear within at usually levels of consumption. For withdrawal, the APA has included withdrawal into the DSM-5. Symptoms include headache, fatigue, drowsiness, dysphoria, depressed mood or irritability, difficult concentrating, flu-like symptoms, nausea, vomiting, or muscle pain and stiffness. People have reported feeling drowsy, having less energy, lethargy, decreased motivation for work, impaired concentration, foggy headiness, decreased feelings of contentness, well-being and self-confidence, increased irritability, hostility, hot-cold spells, heavy feelings in limbs, and nausea.